Enrolling in Medicare can be an extremely confusing process. It's so easy to make mistakes, but so important that you get it right. And these are the top 6 most common mistakes I see that people make and how you can avoid them. And it happens all the time. Clients come to me and they've made a big mistake. They're panicked. Sometimes I can fix the problem for them, but sometimes they're not so lucky and we can't fix the issue. If you don't know me yet, my name is Jane Petrie. I've been a Medicare advisor for over 15 years, and I help hundreds of clients each year navigate the complexity of the Medicare program. My approach is simple. I provide unbiased, honest information. I listen to the clients to hear what their needs are. And with this approach, I help guide clients and lead them to making the right decision in their Medicare coverage. In today's video, we're going to look at the 6 most common mistakes that people make and how to avoid them, why your initial decision is so important, and the expensive traps that could affect your retirement planning. So let's get started. So let's start with mistake number 1, missing the initial enrollment period. So this is how it happens. You're turning 65 and you miss the Medicare's initial enrollment period. This period is a 7-month period and it occurs 3 months before your birth month, includes your birth month, and 3 months after. Missing this period can lead to delaying coverage and penalties. How can you prevent this? Mark your calendar for 3 months before your birth month and enroll during the initial enrollment period. This will help avoid lapses in healthcare coverage and potentially lifelong penalties. So here's mistake number 2, not understanding the differences between Medicare's Part A, B, C, and D. So how this happens is that people are simply not informed, very confused and overwhelmed about the different parts of Medicare, which cover different aspects of Medicare. For example, there's hospital care, which is Part A, major medical care, Part B, prescription drug coverage, Part D, and Medicare Advantage plan, Part C. So it's simple. How this can be prevented is that you do your research. You meet with a Medicare advisor so that you're properly educated to the different aspects of Medicare and what each part of Medicare covers. And mistake number 3, I think this is the biggest mistake you can make, choosing the wrong Medicare plan. How this happens are people are overwhelmed and confused because there are so many different options available to them with Medicare. It's important to understand the options and choose the best plan to fit your personal healthcare needs. How can you choose the right plan? Well, it's simple. It's important to look at the plans that you're interested in and see what the coverage is and what the financial exposure will be to you. Secondly, make sure that the plan that you're considering is accepted by your preferred providers, including physicians, doctors, and hospitals. And lastly, it's important to assess if the plans are going to require lots of prior authorizations. If so, that plan may not be the best plan for you because sometimes, or oftentimes, prior authorizations are denied. And also, don't forget to check to make sure that your current medications are covered under the plan. Mistake number 4, overlooking Medicare Advantage plans' disadvantages. How this happens is that Medicare Advantage plans are oftentimes marketed as free, including many enticing extras like free dental, vision, gym memberships, etc. But what's not spoken or told is that they have very restricted networks, specific geographic networks that you must use providers in or require prior authorizations. And oftentimes the prior authorizations are denied or your providers aren't in your network. So the way to prevent this is to look beyond the free monthly premium and look at what other associated costs are with this plan. What are the copays, deductibles, and annual maximum out-of-pocket? It's important to compare the Medicare Advantage plans to Original Medicare to determine which plan is going to fit your needs the best. Mistake number 5, failing to review your coverage annually. What happens is that people enroll in Medicare and think that that's it. They don't realize that they have the opportunity to review their plans annually and make changes to their plans during the Medicare open enrollment period. So to solve this, it's important to realize that your healthcare needs may change from year to year. And during open enrollment, it's time to reassess your plan to make sure that you're in the most cost-effective plan for your specific medications and healthcare needs. And you can do this every year during annual open enrollment, which is October 15th through December 7th every year. And lastly, not seeking advice from a trusted Medicare advisor. So how this happens is that people think that they understand Medicare when they really don't, or they've trusted a biased Medicare representative that's really not given them all their options and led them in the wrong direction. You want to make sure to prevent that, and the way to do that is find a trusted Medicare advisor, one that's going to guide you and lead you to making the right decision for your future healthcare needs. This is exactly what I do for my clients. I not only lead them to make the right initial decision, but I become their advocate. I provide ongoing services, and I'm always just a phone call away. So if you need help with your Medicare initial decision, please contact me, and you can schedule a complimentary consultation on my website or send me an email. Thank you so much for watching, and I hope you found this helpful. And subscribe for more videos just like this one.